I'm Daniel Arias.
I'm Amanda Tispinette.
I'm Anna Habakkuk.
Hi, I'm Chasity, and this is our project for Professor Navani's class on HIV, focusing on the medication Zydu.
So this is a healthy blood vessel. And these guys represent the red blood cells. And these purple ones here represent the white blood cells. As you can see here, they're happy because it's healthy. Nothing to attack here. Now, with the job of these guys is to kill any kind of pathogen that comes into the blood vessel. And the way that works is that these have certain types of receptors on there, and when they touch a pathogen, it recognizes it as a pathogen, so it kills it. Now, the problem with this is that when HIV comes into play, it mimics the receptors that are on here, and when it attaches to it, the white blood cell doesn't recognize it as a pathogen, so it just keeps going and keeps flowing and doesn't attack the HIV virus. But the HIV virus attaches to it, and that's when it can actually enter the white blood cell. And once it enters in there, it begins replication, and that's when infection starts.
So one of the common questions is, how is HIV even transmitted? It's passed only by certain body fluids such as blood, semen, pre-seminal fluid, rectal fluid, vaginal fluid, or breast milk. These fluids come into contact with mucous membranes or damaged tissues, or they also can be directly injected into the bloodstream. The HIV virus outside of the body will not last long.
Okay, so what we have here is a magnified view of the white blood cell. This represents the membrane of the white blood cell, and these blue spots represent the receptors that are located on the membrane. Now, what happens when the HIV virus comes into contact with the membrane? These receptors then attach to the membrane. Once this happens, the envelope is allowed to get closer to the membrane. Once it gets close enough, it releases, or it opens the capsid, then envelope, opens up, and then it releases a capsid inside of the cytoplasm of the white blood cell. Now, once this capsid is inside here, and then opens up and releases two viral RNAs, and then 3 essential enzymes needed for the replication of HIV. These are known as protease, reverse transcriptase, and integrase. Now, this process is pretty complex. What happens here is the RNA is taken into the reverse transcriptase. Once it's in here, it is combined with amino acids, and it has formed a RNA-DNA helix, an RNA-DNA. Now, what happens here is it is then reprocessed into the reverse transcriptase to form a complete DNA strand double helix. This DNA then is taken by the integrase and is brought into the nucleus of the white blood cell. Now, once this happens, this DNA is then integrated into the DNA of the nucleus. Now, this nucleus contains the genetic information for HIV. Once this happens, this allows for the replication of HIV virus over and over again. Now, when this is transcribed, an mRNA is released, and then it migrates into the cytoplasm of the white blood cell, brought into the protease. Once it's in here, it forms building blocks. The little circles here are the building blocks. It forms the building blocks, and these building blocks then come together with 2 of the RNAs and then 3 of the essential enzymes needed to replicate. Once all these come together like this then forms a capsid. This capsid then travels to the cytoplasm, out the membrane. Once it leaves the membrane, it forms an envelope. Once the envelope is formed, it then leaves the cell, and then it matures and is allowed to infect other white blood cells. And this is how HIV is replicated inside the white blood cell over and over again. So here we are again inside the blood vessel. And as you can see here, it looks a lot different now. Now we have a bunch of HIV viruses floating around the blood. And these white blood cells are no longer happy. Now they're sad because they're being infected. Now, the problem with this is that these viruses, they replicate billion times per day, like billions of times per day. So these white blood cells can't handle so much replication. So what happens is the white blood cells start to die because the viruses are replicating so many times inside of them. Now, of course, this is bad because once these start to die off, you won't have many white blood cells to protect you against other simple infections like the influenza virus or the common cold or other kind of bacterial infections. Since these are gone now, they can't fight it off. And a normal person might get over these kind of infections within a couple days. Well, someone who doesn't have white blood cells, which is a deficiency of the immune system, these kind of infections can actually become fatal and kill the person. And that is how the HIV virus infects the human body.
Why is this important? HIV has 3 phases. The first phase is when the person starts to experience flu-like symptoms, such as fever, swollen glands, sore throat, rash, muscle aches, and headaches. The second phase, also known as the clinical latency phase, is usually when the person is without symptoms because of their CD4 cells fall below 200 cells per cubic millimeter of blood. A person can be in this phase for years not knowing that they have HIV. And the third phase and the final phase is AIDS. A person can be considered to be in this stage when they have one or more opportunist illnesses.
This is the chemical structure of zytosine, also known as retrovir. It acts as a reverse transcriptase inhibitor. It does this by incorporating itself into the viral DNA of the HIV virus as it is replicating within the white blood cell. This halts the production of the viral DNA, which in turn stops the infection of new cells. However, this does not have any effects on already infected white blood cells, and that is why it is important to get tested regularly. There are several different dosing options for cytoludine. If it is given orally, it's 300 milligrams twice a day. For an IV, it's 1 milligram per kilogram of body weight, given over 1 hour every 4 hours. And for the injection, it is a 20 milliliter single-use vial. Daniel?
If you have been diagnosed with HIV or suspect you have HIV, talk to your doctor right away about Retrovir. This medication is often prescribed with other antiretroviral agents. Although Retrovir is not a cure for HIV, it can help slow down replication, reducing progression. Be sure to inform your doctor of all medications you are currently taking.
Side effects reported in 42% through 46% include nausea and headache. 16% through 20% of people reported abdominal pain, loss of energy, rash, fever, and acne. 8% through 12% reported diarrhea, anorexia, moldiness, and somnolence. 5% through 6% reported dizziness, paresthesia, vomiting, insomnia, dyspnea, and altered taste. It is very important to routinely monitor blood levels while taking this medication because it may cause neutropenia and anemia. If bleeding from gums, nose, or rectum occur, you should report this to your doctor right away.
How do I say goodbye to what we had?
Thanks to Retrovir, I'm no longer affected by the side effects of HIV, and I can take control of my life. Thanks.
I'm so excited. We're finally gonna get to go out tonight. It's been such a long week.
It has. That last chem test sucked.
Hey, do you mind if we stop off at the store before we go?
Nah, girl.
All right.
Chastity, why are you buying condoms?
Because, Anna, you never know what's gonna happen tonight, and if you don't protect yourself, who will?
In that case, I'll get some too.
It's important to get testing done annually or even more so often if you are at greater risk. We just had our HIV testing done at the San Antonio AIDS Foundation.
Please visit their website for more information about testing locations and time. The test itself only took about a minute and the results were given to us the same day. Many people, including ourselves, reported an uneasy or nervous feeling prior to the test. This momentary feeling is a small sacrifice we were willing to make. We hope it is one that you can too. Remember, early detection is key.